Alrighty, hello and welcome to another revealed show. I think this is episode 5. You know I'm not good with numbers. Anyway, so thank you. My producer is reminding me it's episode 5. All right, so welcome to Revealed. What is Revealed, you may ask? Well, hopefully you've seen a couple of these before, but if not, Revealed is a live show where we, meaning you, share what plastic surgery procedures you have had done. Share your stories, the good, the bad, the ugly, and everything in between with us here. It's a show about engendering understanding. It's about teaching the masses. It's really about sharing and caring and helping us all get through this difficult thing that is surgery. There are 3 ways to get involved with us here at Revealed. So 1, you can actually join the live. And as I say that, I'm reminded that I should share a link. So I will do that at some point here. 2 is that you can get on the chat and leave a comment, tell us and interact with us as we're here on the live. And then 3 always is to like and subscribe. Now for comments, we love a good comment, and I do mean a good comment. The show is not about bashing people, places, or things. So if you cannot uplift, then shoot. All right? And then know that anyone who comes on the show is not above the question, what have you had done? We all answer that question. Julie, nice to see you too. Thank you for sending the love always and for always being there. So yes, everyone who comes on the show has to answer that question. And hopefully you too will one day share a story with us. But until then, we appreciate everyone who has and who will, okay? So without further ado, I'm going to add to the stage Miss Rosa. Hello.
Hi.
Thank you for coming on.
Thank you so much for having me.
So I find you people on TikTok. And when I say you people, it's a thing that Nigerians say a lot. It's no offense.
None taken.
It means nothing at all. But I find a lot of women on TikTok who thankfully are willing to share pieces of their story. And I invite you guys on because I really am fascinated by how open you are. I think it's amazing because I don't know that I would be that open. So yeah, all the love to you in the world. All right.
Thank you so much. Of course.
So first question is always, what have you had done?
So, more of the like facial stuff, I haven't gotten too much surgical, but I have, dabbled in Botox and fillers. So, I have done filler for under my eye, cheek support, and for my lips. And then for Botox, I've only kind of focused on my forehead, my 11s, and my crows. So that's so far what I've dabbled in terms of, cosmetic and injections. Now, surgical, that would be the breast augmentation that I just had July 7th.
Oh, nice. Close to my
Yes.
birthday. My birthday July 10th. So
Oh, look at
your
that.
boo
Yes.
answer. No, that's great. So you just had them done.
Yes, I am. What do you say? I'm like 5, almost 6 weeks post-op. So on Monday, I will be 6 weeks, I believe.
Beautiful, beautiful.
Yes.
How has the journey been for you so far?
Honestly, it's been amazing. I honestly have had my eye on getting my breast done for so many years. Before I had my child, always been on the smaller side, and
Mm-hmm.
I kind of like made do with what I had. But then after I had my child, I also did exclusively breastfeeding. So that really took a hit on the volume of my breast as it was. I didn't have much to start off with. So there was just always a period of my life where I always wanted that done. So
Yeah.
when I finally made the jump, I remember going through all the different articles, support groups, people's experiences, people who I personally know tell me what their experience was. And a lot of it was scary, to be honest. And so I was very kind of hesitant to really pull the trigger, so to speak, because I was scared of that pain. I
Yeah.
heard it would be a lot of tightness and a lot of pressure. But honestly, my own experience has been nothing but like way opposite of that, like
Oh,
completely on
good.
the opposite side of that. And I'm so happy it's been that way.
Good. No, that's awesome. We actually jumped a little bit ahead. So I should ask you, um, was your surgeon a board certified plastic surgeon?
Yes, he was.
Perfect. And without divulging his name or like where he practices, tell me a little bit about him and kind of your interaction with him.
Yes, so a lot of it, honestly, this surgeon specifically, I actually did it purposely look up. They actually just came about.
Yeah.
I was getting my Botox and filler touched up in my dermatologist's office when I there was this magazine that is very well known in that community. And
Mm-hmm.
I went to the back of that magazine where there was just a lot of highlight surgeons for different
Mm-hmm.
categories of
Mm-hmm.
cosmetics, related areas.
Mm-hmm.
And I ended up going through all those specific surgeons and in terms of California location at least. And
Yeah.
so I went to each individual surgeon that was listed on the magazine. I went to their gallery to kind of, look overall what their overall look was going to be. And
Yeah.
that person's work really stood out to me in terms of the overall aesthetic of what I personally wanted my breasts to look like. And so that was my very first introduction into that person and their own private practice, I would assume. And so then after that, I kind of just read a lot about the person on their website. And then when I actually got into my consultation, very professional, very takes your time. I had other previous consultations where you could tell it was very limited and they kind of had a timeline of exactly what they needed to do. And this specific surgeon did not give me that energy, which I truly appreciated. And then also they have, I believe, over 20 years of experience, if I remember correctly. So among his education and his years of experience, I was very comfortable with kind of pursuing another appointment besides the consultation.
Oh, good. Yeah, I love hearing that. I think there are a lot of people that I've met who have been willing to undergo surgery with someone they didn't necessarily feel comfortable with, but that they saw the accolades and everything like that. So I'm glad that the vibe was there for you and that you
Yes.
went with your gut and said, this is the person, even after meeting other people that probably were just equally as qualified. So that's
Yes.
awesome. About how much did you pay?
Did have, what is it, a 5% discount applied to me because I paid in cash.
Okay.
They do accept and work with different financing options like Care Credit. And I think there's another company I don't remember quite well. But because
Yeah.
I paid in cash, they did offer that 5%. So after everything was said and done, I want to say it was 79.10 that I paid.
Okay.
Yeah.
Okay, including OR, anesthesia, everything.
Yep, everything from the consultation to there was a consultation fee to everything that I needed. My deposit once I actually set my appointment was I believe $810. And
Okay,
then after that I had to pay the remaining balance and that was pretty much in total, if I remember correctly, was 7,910. I could be off,
perfect.
but I know for sure it was under 8,000.
Okay.
Yes.
Nice. With the 5% discount. So that's
Yes,
awesome.
with the 5% discount.
What were your expectations?
My expectations honestly were that one, this person was going to know what I'm trying to describe, and based on my description, and I could, talk about so much of what I wanted until I'm blue in the face, but
Yeah.
interpretation of the doctor, of the surgeon who's listening to me is going to be very
Hmm.
different. So I wanted to make sure there was not going to be any room for discrepancy because
Yeah.
like this is my body and I don't want
Yeah.
to go back for I understand sometimes there's going to be revisions that are out of control that you have to just go back in and do,
Right.
but this person was very well educated, very well informative. I really appreciated how he he really took the time to really analyze my anatomy. Other surgeons that I had gone with didn't tell me certain information that this surgeon did, and the information that he told me about my own anatomy and how that would play in the overall look of my breast augmentation
Yeah.
was very eye-opening. And I was very caught off guard, because I'm like, you know what, that actually makes sense. He really pointed it out. He really, showed me exactly what he was referring to, so I wasn't just kind of guessing. So I was very happy to know that my expectation of him being well qualified and also educated and know what he's talking about. I mean, not to say that going to school for all those years and being board certified doesn't show that, but in talking to me and having me understand exactly what he was looking at from his point of view was honestly exactly what I wanted and my expectation, and he succeeded that.
Oh, good. Good. So I wanted to, because as you were talking, I was reminded of kind of why people have a little bit of a love-hate relationship with breast augmentation. Hate might be a strong word, but the idea is that you may come to the consultation and talk about what size you want to be, right? Just in terms of cup size, in terms of feel, in terms of look, in terms of when you wear your shirt, this is how everything kind of is seen. But ultimately, the surgeon is the one who picks your implant, right? Even if you tell us, I want so and so CCs, like ultimately we have that control to kind of choose and pick what makes sense for your body based on kind of what we think you want,
Yes.
right? So when you discussed, and I should say this also, the number one reason for revision and breast augmentation is people feel like they didn't go big enough, right?
Yes.
So getting the sizing correct is of utmost importance when having this consultation. So how did you guys figure out the right size for you before you went in?
So I feel like a lot of it not only was his part as my surgeon and having all those experience, because one of the things he did say is, in the very beginning of my consultation, after we tried different sizers on, was that a lot of women in his experience wish they'd gone bigger.
Yeah,
So that was something he just kind of flat out put it out there. And so I
yeah,
took that into consideration. I knew what I wanted more or less based on looks of what I've seen, but a lot of it I
yeah,
wanted to make sure even he brought to my attention was that you want to look at women's breasts that are not in clothing or like pushed up in a bra or some type
yeah,
of assistance, because that isn't going to be the way your breast without anything is going to look like. So I really
right,
wanted to make sure I got as close as possible to a realistic image for me. So
yeah,
when I was discussing not only my description verbally, but I also showed him a lot of inspiration pictures that I was looking at and
mm-hmm.
kind of giving him exactly what areas or if the whole thing is what I was really liking in that picture. So when we kind of went over that, in addition to pointing out specifically on my own body what I had issues with and what I was hoping to correct, we
Yeah,
essentially came up with a specific range of CCs. And
yeah,
at the end of the day, he did say, how his procedure day goes. He'll end up going in, trying to see if that would be exactly what that would, if that complements my body and overall
yeah,
accomplishes my goal. If not, he had discretion to make that decision to adjust
right,
CCs accordingly. And I
right,
fully, at that point, I have 100% trust in that man. So
yeah,
I was like, you do what you got to do. If you believe that's what's going to achieve my look, I trust you. At this point, I'm 100% dedicated. Money has been invested. I made the jump with this specific surgeon. And
yeah,
honestly, I feel like if you don't have that trust at that point before you actually get into surgery day,
right,
maybe you might want to rethink that.
right, right, right.
So
No, absolutely agree.
that's how we kind of got into achieving my look or my goal.
The other thing that I ask patients to do actually is to go home, because even when you use the sizers that we get from the breast implant companies, what you're seeing is a ball on top of your skin, right?
Yes,
And ultimately that doesn't always translate the same way. So what I ask
exactly.
patients to do is go home, fill up a few bags, Ziploc bags with different amounts of rice, actually
Mhm.
weigh out the rice, stick it in your bra, walk around, see how you feel. And that will give you a good sense of what you think your CCs should be.
Yeah.
And so they usually report that to me. And that's what I go off of. So it's a little, but yeah, there are different ways to do it.
Yeah, I
But
have
the
heard of
key is
that.
to know.
I was in a few support groups and a few women did mention that method as well. I know from
Good.
my doctor, one of the things that I was actually very impressed was that he was able to pull up some of his prior patients that had very similar anatomy
Yes.
issues or
Yes.
whatever similarities to mine. And
Yes.
based on certain things that I wanted, he's essentially you will be kind of looking like this, and I'm like, oh, that was a really good visual representation, at least an
Of what you
idea.
wanted. Yeah,
So that was
exactly.
helpful.
Good. No, good. Um, what do your friends and family think about what you had done?
They were very nervous. I kind of kept it under wraps in the very beginning. I had only
Yeah.
told a few of my close friends, and then my sister, who she's my closest family member I'm close to. And so
Yes.
my sister has always known that this is something I've always wanted to do. So she was excited, but she was nervous. She was really more of like, just make sure you get your research completely thorough, and you know who you're like, really ask all the questions under the sun that
Yeah.
you possibly need. And my friends were just like, go for it, whatever makes you happy, go for it. They were supportive. But then when it came down to like, okay, this is official, I'm actually getting it done, everybody was like, are you sure you want to do it? Like, all the body positivity, like, your body's
Yeah.
perfect the way you are, and this and this and this. And I'm like, I know they mean well, but it's like, your opinion or your idea of what I look like, does it matter at the day? It's how I feel. So I know they meant
Right.
well with certain comments, but a lot of it was like, you don't need it, you don't even seem like you need a breast augmentation or this and that. And it was just like, okay, I think now they're starting to get a little nervous for me.
Yeah. And I think there's always this fine line of body positivity, right? There's like, yes, we should accept who we are, love who we are. But then if you have friends and family who's on your train and supporting you and saying, you look great the way you are, you don't need to change a thing, there's a certain point where sometimes people may feel like that they're dismissing kind of my own self-image
Yes.
concerns, right? And they're
Yes.
not hearing me when I say, yeah, love me and support me, but also support me in this decision that I'm making to enhance or change in a way that I want to. So yeah,
Yes.
it's a very fine line, but I'm glad that they were very supportive.
Hmm.
Did you feel like you had enough support from the surgeon and the staff after surgery?
Oh my God, yes. I honestly, I'm not that nearby. I'm about 3.5 hours away from my surgeon. So I did stay nearby a few days post-op just because I personally, worst case scenario, I'm not going to be 3 hours away. So I made arrangements to stay
Yes.
in close proximity to them. But
Yeah.
after that, not only were the appointments, I've had consistent appointments for follow-ups. My first post-op was going to be 5 days after my original surgery date. And then I had another one after that and another one. So they've had very much ongoing care and appointments with me to make sure that not only are they dropping, but there's no infection around the incision site, any irritation,
Yeah.
anything of that. Making sure that we're going over, knowing about, capsular contraction as well, or
Yeah.
contracture. So it was a lot of that. And then having to make sure that if I'm not dropping the way I should, am I getting the assistance, which I did end up getting the band to kind of assist in getting the implants
Driving.
to
Yeah.
drop.
Nice.
So they
So
have been very great.
good. So that's important to note. So one thing I always tell patients is about the implants will always sit high up on the chest and be like right
Yes.
underneath your chin. And that's intentional, right? Because we know that gravity works even harder than we do as plastic surgeons. So they will drop into place nicely, but it does take time for that to happen. And it can take up to 3 to 6 months for that to really like kind of be up in place. But yeah, they do they do sit a little higher first.
They do.
Little
And it's funny, everybody tells you, like, women who've gone through it, they'll warn you, like, okay, what they refer to as the Frankenstein boobs, but they
yeah.
really do sit up high. They look a little scary, I'm not gonna lie, but you
Yeah.
have to trust the
Yeah.
process.
Yeah, exactly. Trusting the process. You mentioned that you do have a daughter, correct?
Yes.
If your daughter one day asked you to get the same procedure, how would you advise her? What would you tell her?
I would be completely supportive of her. I know the type of experience as a woman from early 20s, because I always been on the smaller side for my chest, to postpartum with being a mother, to then what that looks like when your body changes after the whole infancy stage, and then you have a older child, and then your own body as a woman starts adjusting differently as well.
Yeah.
So I would 100% support her in that decision. My biggest thing would be making sure that she does her research, more than one consultation, even if that means having to pay those fees. It will be in her best interest to do that, and
Yeah.
also not to make impulsive decisions. I think especially when you're early in your 20s, I honestly, there was a point in my life where I was so close to pulling the trigger with just a doctor I had came across, but
Mm,
I then went to the gallery and I was not happy with their look.
mm.
And I'm like, in my opinion, that's their best work, which is why they're putting it in their gallery.
On there, yeah, exactly,
And
right?
I'm like, I don't, that's not what I would like. And
Right.
so I really had to really pull back. As much as I wanted them, it was a very hard moment for me to pull back and just hold off. So I would support her, just make sure that she does her research. And biggest thing, that they are board certified through the American Plastic Surgery. Just because, there's cosmetic people and then there's
Yeah,
plastic surgery, and those are
right.
two different.
Two different
So
things.
yeah.
Exactly. Exactly. One thing that I picked up on that I only recently like understood in a better way was this idea of you meeting with multiple doctors. So as a physician, we were always not taught, but like you got the gestalt that this idea of doctor shopping, right? Like
Mhm.
you people will come and meet with you um and consult with you, but then won't move forward to go ahead with surgery. But that's a bad thing, right? So on
Mhm.
our side, it's like, oh, this person isn't committed, this person isn't ready. Um, and I had a patient who met me, and I was, I think, either the third or fourth person that she had met um, for a procedure. And it had been, my patient coordinator said to me, yeah, she's shopping, right?
Mm.
And so when I went to the consultation, I did say to her, so I know that I'm like the third or fourth person that you're meeting. So I just wanted to kind of figure out with you kind of what's making you meet the different people that you have met and what has made you not yet sign up with someone.
Mhm.
And what she said to me was so eye-opening, and I don't know why it was so groundbreaking for me. Because I think I talk about this too, right? She said the vibe was never right.
Mhm.
And it never felt like I was really a priority with them, and the bedside manner wasn't really there.
Yes.
And um, and so she became my patient, which was lovely. But the one thing that I hadn't like figured out before then was this idea that what looks like someone is not committed on my end is them making sure that whoever cuts them open is like 100% the person for them,
Yeah.
right? And yeah, it was just changing. That paradigm shift was so eye-opening for me, and it's changed now the way I think about people who are, you know, doctor shopping. So no, I love
Oh.
that. I love that.
Yeah.
Um, do you think plastic surgery is addictive?
I can see that. I was funny that you say that, because I was literally just having this conversation with my friend. I was literally
Yeah,
telling her I could see how it could get that way, because for me, I started with filler and then I went into Botox, and I know those are completely different, but then the feel good. I feel like the aftermath is what gets you. I want to do a little more. And
yeah,
the breast augmentation, granted, I always wanted that since my early 20s, but because of the overall look, I feel way more confident.
yeah.
And I'm just like, I feel like I'm just genuinely more happier, like, as the day
Uh,
goes by. I'm just happy. Because it's just,
yeah,
it is what it is.
yeah,
And now, not to say that you want to nitpick, at least not in my experience, but now realize it's not as scary as it was, at least for me. I
right.
remember just going into the OR. I woke up and then went to my hotel, and I was just kind of, it went so fast, and I
Yeah.
expected it to be so much longer and a lot more complicated and a lot more painful, and it was not that. And I remember on my second day post-op, I'm like, man, that's it, like I really did it. Like I got that out of the way. And granted, a breast dog, the pain and recovery is drastically different than
It can
a
be. Yeah.
liposuction or a BBL.
Right.
But
Right.
I could see how now that you got that fear, so to speak, out of the way, you might be willing to do another one, a little bit,
Yeah.
dabbling into something more. So I could see how it could become addicting.
Yes. Yeah. I can too. I can too. Have you had
Yes.
any complications? It doesn't sound like you've had any.
So I did have a slight complication. It was due to a allergic reaction. So now I know at 31 years old that I'm actually allergic to penicillin.
Oh,
So
okay.
yeah, I had gotten the antibiotics to take post-op, and I
Yeah.
remember, I think it was on day 2, I started having this really red itchy rash on my
Oh,
chest,
wow.
my shoulders, and
Yeah.
into this area, and it was just so itchy, and I thought that it might have just been, I honestly really didn't know what it was, so I just took like some Benadryl topical, and I normally take an allergy medicine, so
Yeah.
that kind of helped subside, but it was still really, really itchy. So then I called the after-hour emergency, and someone answered. They took care of me immediately, which is another reason why I really love how they take care of you post-op.
Yeah. Yeah.
So, the nurse was like, oh, you know what? For the meantime, I think this is what's going on, but we'll probably have you come in and double check just to be on the safe side. Sure enough, she's all like, oh yeah, you have hives. She's also discontinue. Do not be taking this anymore. We're already far out. I think you're healing very well. So it was in their professional opinion that I didn't need to continue that course of antibiotics. And
Yeah.
so I just happened to be allergic to. They're like, and so moving forward, make sure that you also communicate to any medical professionals that you have had a allergic reaction to penicillin.
Yeah. Exactly.
Yeah.
Exactly. And then
So
the other
that
thing I
might be
should
the only
say is,
thing.
well, that's good. That's really good. The other thing I should say is that
Yeah.
not everyone prescribes antibiotics after a lot of these surgeries. Um,
Yeah.
so people shouldn't be afraid if they go to a doctor who's like, nope, no antibiotics after surgery, and then they're like, well, I heard Rosa had antibiotics, and
I
so
don't know.
it's
It's so
it's
interesting
variable.
because surgeons do things completely different. Because even
Yeah.
like mentioned, I've done a lot of research and been a part of a lot of, social media support groups for
Yeah.
this kind of stuff. And there's a lot of conversation about the post-op surgery compression bra. And so
Yeah.
I expected for me to get that, but my surgeon specifically didn't have me in that. And I didn't wear a bra post-op, but it was, to my understanding, that it really varies on the surgeon and how they like
Yeah.
to move forward with that. So there's some who do and some that don't. So like you mentioned, some may prescribe the antibiotics, others may not, but it really is talk to your own doctor.
Yeah, exactly. Medicine is an art, and plastic surgery definitely is an art, right? Everyone has a little
Yes.
bit of different take on it. What concerns or anxieties did you have during the healing process?
I was really concerned with which is the capsular contractor. So I
Mm-hmm.
was really scared of that just because of the statistics of it occurring based on like my own implants that I chose, and just generally how that would, possibly, that's something that's really big and take into consideration. And
Yeah.
so I was very big on the massaging techniques that I was told to do. So I
Mm-hmm.
was very diligent with doing that because I was like, if I could do anything to help alleviate or reduce that risk, I want to do it. So I was really scared of that. And I was really scared of my implants, what I've been referred, or what I've been told is referred to as bottoming out. So I was scared of
Mm-hmm.
those two things. So far, I
Mm-hmm.
don't believe I had either one of those issues, but those are the things I was really scared of.
Yeah. So capsular contracture, um, for those who don't know. So the body, whenever you put a foreign body into a person's body, the body will react to that by forming a capsule around it just to kind of wall it off.
Mhm.
The wall that it makes is usually consistent with just kind of like a soft film. And so again, around breast implants, that's usually just a soft film. Capsular contracture is when that soft film becomes hard because it becomes calcified. Usually it's a process that doesn't happen right away. It takes actually years. And so the risk of it increases with the year of the implant. And so by the time we get to about 10 years, we're at about a 10 to 50% rate of capsular contraction. And so that's why historically we've said change out implants after about 10 years, because as the implant gets older, you have this increased risk. You also have an increased risk of rupture of the implant. So those two kind of go hand in hand.
Yes.
But yeah, it can be something that's painful. It can be something that it makes the breast look distorted. So it's something that you should be aware of for sure.
Yeah, and it's so interesting to know that it's not, when you think about it, if you're not really, well versed on the subject, you think that it's just the beginning, but it's like, no, like you mentioned, it can really, as the time goes on, the chance is still much there, and you're still having to look out for that. In addition to, like, the for me personally, I have placement under the muscle, so
Yeah.
then the animation deformity, I was very scared about that too. So
Yeah.
there was just things that like pros and cons on the placement of the
Yeah.
implant, and it's just something that you kind of need to talk over with your doctor.
Yeah, for sure. Okay, last question. What have you learned from all this?
I've learned that, you know, um, s- if you take the time to really do your own due diligence, not only as a consumer, but as a person who is trying to better themselves in any capacity, in this case, it would be for physical appearance. I
Yeah.
would say that you deserve to take the time and really get into learning about the surgeon, learning about the procedure, investing in yourself for that time, because your body is worth that investment of
Yeah.
taking it slow and not making, very fast, irrational decisions because you just want something, you want the
Right.
overall look. So I really would say that would be my biggest lesson in this, is that I'm happy I took as long as I did to finally commit to a surgeon, and I did as much research as I did. I'm happy. I couldn't honestly believe it's been as smooth and as like satisfying of a recovery for me as it's been. I did not anticipate it to go this way, but it's been really amazing, and I think that me slowing down to really do my due diligence really paid off.
Yeah, no, I think you're the ideal patient, the patient that's coming in well informed, that has questions, that is open to having a really big conversation, doesn't have this big kind of black box over what am I about to do.
Hmm.
I think that's really the ideal patient. So thank you for doing all that work and for showing up prepared. And it really does show, right? Because in your kind of post-op recovery, you've had a really, really great one. And I don't know
Yeah.
that it would have gone as well if you hadn't known what to look out for, how to prepare, all these things. So
Hmm.
no, kudos to you for sure.
Yeah.
All right, real last question. Anything that you want to share, any advice that you want to share or anything that I haven't asked you?
Yes. So one of the things I honestly, in also being informed to the best of my ability, one thing that I did not know until I actually experienced it was the nerve pain. So, really get into that. You may think like I didn't experience it right away. I think it
Yeah.
was like maybe a week or two after, probably 2 weeks post-op. And then I'm like,
Hmm.
wait a minute, what is that? And I'm so happy that my surgeon gave me like this little pamphlet of, what happens pre-surgery, post-surgery, and, emotion, just a whole bunch of information. And I
Yeah.
remember referring to that little handbook, and I read that and made sure I was very familiar with it front and back before the day of surgery, because I didn't want to, have the unknown. And so when that started happening, I'm like, oh my God, that's what they were referring to. It's the nerve
Yeah.
pain. And so
Yeah.
there were some recommendations about how to alleviate that. And I did not even hear about that in much of the, research that I was doing, or
Yeah.
in the communities of social medias I was in. That really took me aback. So I remember, knowing that it was normal and
Yeah.
thankfully it was very manageable, but that really threw me off. So I'm just like, sometimes you could do as much research as you can, and there's just some things that may pop out last minute for you.
Right. So the nerve pain, just to talk about it just a little bit, is this phenomenon that happens because when we make a cut on the skin, we cut nerves, right? We
Hmm.
we go through nerves. Um, those nerves aren't gone forever. They do regenerate or come back. And as they're coming back, as they're regrowing, you can get kind of this pins and needle sensation that
Yeah.
happens. And so that is very common. That's very normal. And that's actually very encouraging because it means the sensation is returning to normal. So it's good, but it
Yeah.
doesn't feel good at the time.
I know,
For sure.
yes. And I was like, wait a minute. But yes, I was happy that I was, something that that doctor had talked to me about and made sure it was part of his, informational stuff that he gives out. So that was very reassuring to know that. I was like, wait a minute. That was a little different. So as much as research as I thought I didn't,
Yeah.
I was not expecting that.
Yeah, no, understood. Well, thank you so much. Thank you so, so very much. Talking to you has been a true pleasure. I think we've learned a lot about breast augmentation, about what the process is. So it was so great to have you. Thank you again.
Thank you so much for the opportunity, what you're doing in this community. I'm so excited to see it flourish. And I would just say, keep doing what you're doing. It's amazing to have this kind of community for those who are interested in this.
Perfect. Awesome. Have a great night, okay?
Thank you, you too.
That was Rosa. She was very, very beautiful, very pleasant, very easy to talk to, and I think very informative as well. So that's what I got today. um, we're here every third Friday of the month, except next month. Okay, I'm going to Tokyo. Yay me! So that means I won't be seeing you in September, but we'll come back in October with a new show. Hopefully more of you will join us because I know you love the channel. And again, have a great evening. Good night.